Good afternoon, everyone. Thank you for joining us for the Blakely Health Innovation Series. Everyone here in our audience today and our hundreds of online viewers, thank you for watching. Welcome to our wellness webinar titled Change for Good. My name is Grace Lombardi, President of Fuel Productions and Director of Communications for Chin Radio TV International. My husband Lenny and his father, Johnny Lombardi, pioneered multicultural broadcasting in Canada with Chin Radio TV International. For over 50 years, Chin has delivered multicultural, multilingual radio and television programs across Canada. I have also, I can say, have the honor of being a board member on the Toronto Rehab Foundation board. Toronto Rehab truly is a place where incredible happens, and that's why we are all dedicated to these webinars and just educating for health and just well-being. As members of the media industry, we recognize the key role that television, radio, and other broadcast programming plays in educating and inspiring communities. With today's webinar, delivered online through YouTube Live, we know the possibilities are limitless in attracting a global audience to learn about something important to all of us, our health and wellness. And through this series, our hope is to help inform a movement on wellness in Canada. As a global leader in physical rehabilitation and prevention, Toronto Rehab aims to help people live active, healthier, and more independent lives. Across its 5 sites, Toronto Rehab supports the recovery, rehabilitation, and healthy return back to home and community of individuals affected by aging and by conditions such as brain and spinal cord injuries, heart disease, and stroke, and more. As a member of the University Health Network, we share in the vision of a healthier world. Before we begin, I would like to thank our generous sponsors who have made this series possible. Likrilyn, Raymond James, Wellwise by Shoppers Drug Mart, 33-7, behaviour, Scotiabank, and McLeish Orlando Lawyers and Oatley Vigmond Lawyers, who also sponsored the lunch for the audience here today. Thank you. As mentioned earlier, we are broadcasting live from Toronto Rehab's auditorium in downtown Toronto, and we are excited to have viewers from across Canada, including many companies who have encouraged staff to join in either at their desk or in their offices and boardrooms around the lunchtime hour. We have about 32 companies joining us from coast to coast. Oatley Vigmond, lawyers in Barrie, Ontario. Hi, Angela and team. A big shout out to the group from Raymond James, one of our sponsors, who has viewers in Quebec, Ontario, and BC. Medavie Blue Cross, with a large contingent from New Brunswick and Nova Scotia. Mercedes-Benz in Waterloo, Ontario. Sun Life Financial, Scotiabank, TD, CIBC, and BMO. Welcome. And also a hello to University of Toronto. And let's not forget our UHN family, Princess Margaret Hospital, Toronto General Hospital, and Toronto Rehab, with staff viewing from the Rumsey, Lyndhurst, and Bickle sites. Thank you, everyone, for joining us today. Now, let's begin Change for Good. We initiated this series because we truly believe that our commitment to choosing better health today will positively shape our lives tomorrow. Today's webinar is the first of 4-part series that will take you on a wellness journey over the next 6 months. We will learn about important pillars of wellness, such as creating a health plan for success, improving mental health and well-being, and the importance of nutrition and exercise. Let's start by mapping this journey. How do we go from acting on an idea to sustaining a health behavior? Why is it that some succeed and others fail? And why is it important? To help us with this plan and ensure its success is the notable Dr. Paul O., an esteemed international speaker and medical director of the Cardiovascular Prevention and Rehabilitation Program at University Health Network. At the University Health Networks, at the Toronto Rehabilitation Institute, and the Peter Munk Cardiac Center. That's a mouthful, doctor. In September 2014, he was appointed as the inaugural Good Life Fitness Chair in Cardiovascular Rehabilitation and Prevention at UHN and University of Toronto. Today's webinar is live and interactive. Once Dr. O has finished his presentation, we will take questions from the audience in the final 15 minutes of today's webinar. While you watch, we encourage you to send in your questions and email them to trf@uhn.ca. The email address will be at the bottom of the screen throughout the presentation, I believe. And now, without further ado, the man of the hour, everybody's here to see this wonderful speaker, is, I'd like to welcome, please, Dr. Paul O.
Well, thank you so much for the very kind introduction. It's indeed a privilege to be here with you. It's fun to actually have a live audience as well as one online, but we do appreciate all of you taking time out of your day to join us on this first step of a journey towards wellness. The specific objectives for this afternoon, for this next 40 minutes or so in terms of a didactic part, will be to describe change. What is it? What is the science behind it? Sharing some insights from our own work in the clinical realm, trying to adapt that to our personal lives around health. We could be talking about organizational change, other sorts of aspects, but here's where we'll focus on health in our lane for this afternoon. Think about how complex it is to make a decision and then follow through with a health behavioral strategy. And then we'll present you in a David Letterman fashion. What would the top 10 things be if we're going to do this in a structured, logical way so that we actually can be successful? Because change can be tough, and it's wired that way. So where does this come from? Our groundings, as you've heard from the wonderful introduction, is around health and rehabilitation. Our jobs often in our branch of healthcare is to help people on their journey from the hospital to home, from the bed to living well in their own environments. And there are many things that we can do as healthcare providers. The tough work, though, are all the decisions that we need to make individually on a daily basis. And that's some of the stuff that we want to deconstruct. Why is this important? Why is it worth your lunch hour to spend with us? Well, part of you are captive and you're here, I know that. But others, I think, have made the decision. You've actually made a good choice on how to spend an hour. And the reason it's important is because we are facing this on a regular basis in our hospitals, in our health system. Now, the tree looks very lovely in terms of being a healthy symbol of a plant, of a symbol of wellness. But we can also think of it in the other way. It's a tree can be a symbol of what we're dealing with in healthcare today. If we think of the branches of the tree not as health, but actually as illness, that there are many expressions of illness today that represent these things called chronic diseases. Heart disease, lung disease, diabetes, cancer, arthritis, mental health, so many branches on this tree. The interesting thing is that if we spend all of our time just trying to prune the tree, that we can spend a lot of time and effort, and we do that, and there's wonderful work all across UHN and across our whole healthcare system. But perhaps if we want to get to the roots of this, literally the roots of the tree, come down to the health behaviors that we engage in on a daily basis, that we have choices specifically on what we eat, what we smoke, what we drink, and whether we move or not. It's interesting that 80% of the expressions of chronic diseases are rooted in those fundamental health behaviors. The stats that are shown on the left-hand side of the screen show just how common this is, that the vast majority of Canadians, especially as we get older, are living with one of these chronic conditions. I would wager that 95% of us in this room and probably online could identify a health behavior that we could start working on today that actually affects that trajectory. And, here are some examples of those fundamental health behaviors and their impacts. For instance, being active, we know that that is good for a whole array of conditions. It'll reduce the occurrence of heart disease and diabetes. It's as good for mental health as any medication that we might offer, with only good side effects. Alcohol is connected perhaps in slightly positive ways, perhaps in slightly negative ways as well. It's a tough one that we need to think about. Diet is closely connected to many aspects of our health. Did you know that eating more fruits and vegetables, nuts and seeds, having healthy oils in your diet can lower your blood pressure over 12 weeks as much as any medication that I can offer you today? That's what your power of choice can make for you. And quitting smoking, for people who are smoking today, the single most important health choice that we can make is to quit smoking. So lots of things that we can do, but changes can actually be quite tough. So we thought it would be useful just to spend a minute on what is it that we mean by behavior change around health. Go to the 101, because it seems like things might be stacked against us. Let's go through like a Disney-like journey, right? We're going to go through the darkness of how terrible the world is before we emerge out the other side with life and light. So here we go. So here's the thing in today's society, that chronic disease is common, poor behavior is common, and in fact, that just seems to be the norm. If you want to embark on a health journey, although we're all committed to doing so, it may seem like we're trying to swim upstream against the current, against the norm. Bad seems to be the thing that's going on. Like 80% of Canadians might not get enough fruit and vegetables in their diets. 95% of Canadians don't get enough physical activity in their daily lives. That is the norm, but we need to turn around that. Even the world, the rules that govern the world. Let's go to physics. Any physics geeks in the audience? No, none of you will admit that. But let's look for some inspiration here, because this is the science part of this. So if we look at the 3 Newtonian laws, so Newton, that guy, that old English guy that talked about the apple falling and things like that, there are 3 laws of physics. And I'm just bringing these things up because this tells us how the universe is stacked against us. Rule number 1 is around inertia. That is that things tend to stay the same. That's the way things are wired. And here's my inspiration. I had the privilege of going and spending a few days in China this summer. We actually saw some panda bears that are incredibly cute and delightful. But kind of taking that health lens to it, pandas are incredibly scary, because once they get into a position like this, wrapped around a tree or splayed out on the ground, that's where they will stay for the rest of their day until somebody decides to feed them. Inertia in action, well, that's a misnomer. Inertia is the way it is. So here's one takeaway if you don't like the physics journey. Don't be panda, okay? Don't be panda. Maybe that's your one health journey for today. Physics law number 2 is that to really cause a change, you need a massive force. You need mass and acceleration to really change something. So to unravel a set of billiard balls, you've got to fire something out there that's equal in size, greater in power to really cause that change. But often the things that we're trying to embark upon, we may not have that commitment. We may not have that mass. We may not have that force to change things. So change is left on the table. Number 3, well-intentioned. The Newtonian law says that for every reaction, there's an equal and opposite reaction. So think about that as we try to change. Or if you're having a lovely holiday dinner with your family and some kind family member tells you, that sweater's a little snug, isn't it? You're looking a little bit slovenly, aren't you? I think you should be changing. Your immediate response to something like that is, I'm going to show you, and I will not take up that journey. I'm going to push a little bit harder in the other direction. And indeed, that's how health works. And the painful lesson for me in medicine was, what I learned in medical school was that, oh gosh, I am the cream of the crop. I'm the top of the pyramid. I have spent umpteen years in school. I had a library card actually for 20 years that was active. That's how much time I spent learning about stuff. Surely when I graduate and I tell people to do things, they will do things, right? Sadly mistaken, because when we have that conversation, I have the solution for you. You need to eat better. You need to move more. And that's all I need to do because I've given you my blessing. Good luck. When we meet 6 months later and lo and behold, the food patterns have not changed, the activity has not changed, health has not changed, because this kind of thing of being directive and forceful is met with an equal push the other way. In fact, it overcompensates. And we may have had this experience in our lives. So the rules of the world are stacked against us in terms of change. It's in our families, it's in our environments, it's in our genetics as well, isn't it? So there's interesting data that would say if our kids grew up in a household that may not be as healthy as we would like, and body weight is not the only thing, and is definitely not the marker of health, but it is interesting kind of of area to study, that it is far more likely for kids to grow up obese if that's the environment that they are in, or it is far more common for kids to pick up smoking. There's a scary little image there, isn't there? It's far more common for kids to pick up smoking if they are brought up in a smoking household, isn't it? So the environments are important. Maybe change is impossible. Gosh, the universe is against us. Our families are against us. Our homes are against us. Should we just give up? The motivational triad, perhaps we're also wired in the wrong way. Doug Lisle is a psychologist who wrote about this, and others have kind of brought up these sorts of concepts as well, of why do we change? And breaking this down into 3 sorts of components, that the behaviors that we adopt are often the ones that give us pleasure, and then we're wired to seek that, right? There's chemical signaling that happens in our hippocampus that says, this is pleasurable, you get a reward, you feel good, and then we keep doing that. The opposite of that, of course, is that we avoid things that cause us pain. We're smart that way. Touch fire, don't do it again, right? Because that hurts. And that's a good survival sort of thing. And then along the way, we've also learned that we must conserve energy, because who knows when we'll need it. Think panda. Panda, conserve energy, eat bamboo shoots, don't move, avoid anything painful. But is this the picture of health that we want? This is the way we're wired. Oh, we are doomed, aren't we? We are doomed. Maybe there's some hope, though, because change is possible. And if we're thoughtful about this, we can bring the right kind of framework to the table. So let's present an alternate model of the world, that notwithstanding our biology, notwithstanding the rules of science that dominate our world, notwithstanding our families and other environments, that maybe change is possible. And if we actually appeal to our higher selves, and I believe that we have a higher self where we actually want to be the best selves that we can be. But here's the tools. You don't need me to tell you things. What we need is the growth to come from within. And Desi and Ryan, who are 2 other psychologists, developed this framework that I actually quite like called self-determination theory. That we actually can be successful being healthful. We can be successful with change if we think about 3 domains, and then what our jobs might be as healthcare practitioners, as supportive family members, or maybe as ourselves embarking on a health journey, is these sort of areas. That we can be successful if we can master an area, right? So for those of you who have spent the proverbial 10,000 hours learning a trade, a craft, a skill, you got that down. I got this, and I can do this, and I feel comfortable with that. But for me to talk to a non-exerciser to just say, go to the gym and join the spin class and have fun, because it is fun, it can be daunting. I don't have mastery over that task. I'm not going to do that. There is that fear factor. Maybe it's bringing in pain into this. So let's build those skills step by step in terms of developing mastery. Autonomy means we don't like to be told to do things, right? We love to make our own decisions. And think about our own environments. Do we create that autonomy in our jobs, in our lives, in our leadership opportunities? Or are we always beaten down and told? We will all be far more successful if we can make our own decisions, have the skills to do that. And then connection in networks is incredibly important as well. That we will, most of us, be successful if we have a social environment that will create the norm. Everybody goes out at lunch and walks, or everybody eats plants, at least some of them, for their lunch times. Or we have social networks that can support us, help us through the tough times. We need those connections to actually be successful. Finally, I think all of this can be done very, really well. Change is possible when we have that guiding star, a focus, a compass point, the purpose of doing this. So don't just change because someone said change, but change for a reason. So this is going to be our path forward. The background then inspires us to think about what our top 10 might be around change. And here we've broken it down, and maybe there's something on this list that will talk to you. Maybe it's the pandas that talk to you, okay? So here, let's start with why. Think about where we're at right now on the change spectrum. Develop some balance between changing and not changing, and what are our beliefs around that. How do we think about, identify, and then overcome barriers, which is really important in the change experiment? Where am I now? Where do I want to be? And then what's the roadmap to get there through SMART goals and actions? Think about opportunities. They're around us all the time. This doesn't have to be as difficult as we might want it. Think about that social connection and supports and how to bring those into our lives, or leveraging things in our environment. And then step number 10 is thinking about relapses. That's part of the plan, actually. All right, you with me? I hope so. You haven't tuned out yet? Let's go through this step by step. Step number 1 is why, right? So if we think of this in a targeted format, the place that we have to start is why. Simon Sinek, and some of you have seen him with his TED Talk, others have also become why champions. And I think we will all kind of resonate with this, that the reason we do things has to start here. Often, though, we start with the plan, the how. I will do A, B, and C. I will meet with this person, that person. But without the why, we're not sure about what the reasons for our pathways here. Simon Sinek will say, people don't get what you do, they get why you do, right? So think about that in your own change. You know, not just lose weight, but why? What is that? The what will come after that. What are the steps that you're going to take? And then finally, the how. The mistake we often make is the outside in, without actually focusing on the reasons, the purpose, the northern star that we actually need. Think about where you are in a stage of change. And for those of you in the room, it's hard to do this online. For those in the room, who's heard of Prochaska? Another psychologist, behavioral theorist, who's heard of stages of change? So just thinking about, if you want to do something, and the answer was about 5 people in the room, so thank you. So if you want to think about, I'm ready, I want to make a change, ask yourself, am I actually ready for this? And you know, one of the classic things that we get into in our health programs is thinking about people who smoke. You know, we can always counsel, and I've already said that if you find somebody who smokes, the single most important thing that we can do as a healthcare practitioner is help that person stop smoking. It takes on average 13 tries to quit smoking, though. And for me to tell somebody who is not ready for a change to quit smoking is kind of a lost interaction. There's lost opportunity for us to actually engage in a meaningful way. For me to say you got to stop smoking when you're only thinking about it is not going to be helpful. If you're ready to take action, that's when we can catalyze on that, all right? So that's what this model is about, that people move through a progression of thinking about things, preparing for action, taking action, maintaining things for life. Some people even think of this as a stepwise thing, that I got to move through this. One kind of nuance on this, though, is that I think motivation is actually a little bit more complex than this, and people are a lot more complex. That we're not linear, we're not stepwise. And in fact, motivation may be more like whack-a-mole. That we have to be ready when those opportunities rise, and who knows what motivates us at different times, but be ready to act on that. You know, so I've seen a gentleman for the last 15 years for health counseling, and smoking is the thing. And every 2 years, he's ready to quit smoking, and I jump on that and said, this is great. Unfortunately, 2 years later, he may say, I've started up again. So then we start up that cycle. Be ready to whack the mole when it comes along, but don't be panda. Number 3 would be thinking about the balance points, right? So change should be good. And for all of us, we would say, of course, this is nonsense. What do you mean? Why do we even have to have a discussion? Being active is a good thing. Eating more plants is a good thing. Not smoking is a good thing, isn't it? Well, let me tell you the conversations I have with smokers or eaters or people who like actually binging on Netflix, that we actually have a lot of benefit from the things that we are doing. I am told I've never experienced this myself, but I am told there is no nicer feeling for a smoker than to wake up first thing in the morning, light up that cigarette, take a drag off of that, get that hit of nicotine that enters your bloodstream within 10 seconds, lights up your amygdala, suddenly everything is firing, everything is good with the world. Who wouldn't want that feeling? There is a lot of investment in kind of being in that position, all right? We can say, this is terrible for you. It's killing your lungs, it's killing your heart, it's killing your brain. You are addicted to the most powerful substance known in the world. You are wasting your money. You are literally putting it on fire and lighting it up in smoke. But people are fixed on, this feels good to me right now, right? So change is difficult. And change will only happen when we can think about the benefits of change actually outweighing the costs of staying the same. But people have these fixed beliefs in why they are the way that they are. In advanced motivational interviewing, which we sometimes use in our clinical practice, this actually becomes a fun game to play. I could see that you've got lots of benefits from smoking. It's good for you, isn't it? If I play that resistance game, your response to me is, wait a minute. What do you mean you're telling me that smoking is a good thing? What's wrong with you as a healthcare practitioner? I can tell you a whole bunch of reasons why I should quit. So people can come up there with their own plus signs on their own. But if I told them those things, it may not work. That's a sneaky way to do motivational change. It may be manipulation as well. Furthermore, change can be a little bit more complex because change seemed to be easy, right? But if I asked all of you, can you identify something that you really want to change? Do this mental experiment for 15 seconds amongst yourself. Is there something that you've tried to change within this last year? Now, have you been successful with that change? Successful? Or is it something you've tried to change before and it's kind of returned to you? And if you wondered why, I had this interesting opportunity to spend an hour with this guy, Bob Keegan, who's a psychiatrist at Harvard. And he wrote this book called Immunity to Change, and the reasons why change is difficult. Not impossible, but it's difficult because if we start with this, identify the reasons that you really want to change. Go to step number 2, which is interesting. Identify your behaviors that actually act counter to that goal. All right? That we are doing things that may sabotage ourselves. And number 3 actually is that we actually have really strong commitments to sabotaging ourselves. So for me, I was chatting with Grace that it's an interesting month for me where I think I am doing about 35 presentations this month, literally, which is very exciting. And there is somebody to blame for this not so thoughtful scheduling, and that person would be me. You could tell that maybe one of the things that I've wanted to do with my own life is actually take some control and not be overscheduled. You would say that? Yeah, that would be a good idea. And I wonder, so I would say I really do want to change. I want to take control. I want to not be so overscheduled. But then if I look at number 2, think about the behaviors that act counter to that goal. I love to get calls to say, would you like to do this or that? And I will typically say yes, especially if it's Arlene or if it's Jen from the foundation. I will typically say yes, because there are good things that will happen if we do those sorts of things. And I like to please people about what we're going to do. So I will say yes to those things. And then what the interesting thing is, though, if I look at number 3, if I honestly want to peel back some layers for you and say, why would I want to do that? Why would I want to say yes? Is it because Arlene and Jen are so persuasive? Is it because they strong-arm me at times? They might do that, and I want to avoid that pain. Or is it something else that's just in my nature? And is it that part of the reason that I do these things is that I actually love to do these things. This is where I get energy from. So I get that external feedback from these things, which drives me to do number 2, that I will sabotage my own efforts to unschedule myself, which leads me to number 1, that I will never change, which is actually a very, very scary thing. So that sounds like a fun, kind of humorous sort of thing. But think about that in our own lives. Whether it's smoking, whether it's eating, whether it's some other kind of behavior, are we actually harming ourselves because that's where our fixed beliefs are, all right? If we're doing this a little bit more seriously and I was peeling back a few more layers, you'd find out too much about me. But number 3 is the tough part. Identify the commitments that we are actually firmly fixed in supporting bad behavior. If you want to start off a conversation, then these are some good questions to ask. Michael Vallis is a behavioral psychologist from The Atlantic who's done a number of wonderful workshops in this area. And then this might be a good conversation starter to get us into this journey. The immunity change is a tough one. But do you consider whatever you're doing to be a problem? Are you interested in making a change? Why do you want to make that change? Being really, really clear about that. Are you ready? Thinking about that road to readiness. And then what are you going to be willing to do to make this happen? Okay. I will move along because we're on step 4 of 10. Number 4 is around the barrier stuff. And often we just embark on the change journey without actually acknowledging that there are some things in our way. It's great if we actually unearth these things ahead of time and do some problem solving. Otherwise, we'll be stymied by the wall. We'll actually hit it at full force, and then we'll stop. And I don't know if anybody else has had that kind of experience in the past, where you wanted to do something, you didn't think about the barriers, and you actually got into some trouble. In our world of cardiac rehabilitation, we deliver a lot of exercise programming. It's important to have this conversation because for me to tell you to go get active without unearthing some of these things is going to lead to a failure. Is it time? Is it money? Is it lack of interest? Is it you're afraid of pain? Once again there. Is it that we lack mastery or we lack autonomy? If we have the conversation ahead of time, maybe together we can actually develop some solutions. Our job is not to tell people what to do, but is to facilitate that discussion and develop some coaching so that people can actually be successful. You know, along the change journey, sometimes a lot of time we have to spend at the beginning just figuring out where are we right now. Whether it's a physical activity thing, whether it's a food thing, but do some work on figuring out where you are and have a clear goal idea where you want to get to. It's interesting where we just start to jump in and say, I'm going to change. How do you know that anything has happened without actually developing a little bit of that map? When you start to get in some goals, make them smart. And for the therapists in the room, you do this all the time. But it's interesting, sometimes we just kind of throw things out there. And actually, this is a bit of literacy that we don't teach in society so much, right? We just say, go make change, without actually being thoughtful about it, that being specific and something that we can actually measure and actually can be achievable in a reasonable time frame is really, really important. That's how we're going to do it. So there may be big things and there may be really small things that can actually give us a little win and move things along, which is really important. The literature would say that if you actually follow a process of goal setting, you'll be far more likely to achieve the end point than if you don't. If you want to go through a bit of an activity, we'll bring you back to our web platform around patient education that's called the Healthy University. And within that, there's this 12-step program that's called Thrive. And Thrive, we encourage you to start with tile number 1, which is called Create a Plan for Change. So if you want to go through this as an exercise, as a takeaway after this session, creating a plan for change will ask you to define a vision. What is your why? Why is your why? Set a goal. Build the action plan that might look like this. What change can you make? What's the plan going to look like? Here are some examples of where you might want to go. What is it that you want to do this week? How confident are you? How important is this to you? Ask these important questions on whether you're ready and willing to make the moves on getting active. Be very specific. When will you do this? Where will you do this? How much of this will you do this? How often will you engage? And if we can answer all of those questions, put it on a calendar, we'll be far more likely to be successful. So here is a plan for my next week if I can ever stop talking. There we go. And then sometimes we get in this trap of, oh boy, I'm so inspired now. I want to eat better. I want to move more. I want to stop smoking. I want to take all my medications. I want to have better relationships. I want it all. Well, trying to tackle all of it all at once may not be the thing, right? And you know, when we work with people with diabetes, there may be 16 different things that we want to work on, from nutrition to medications to eye care to foot care to kidneys to heart to relationships to sugar to food to all these sorts of things. Breaking them down into single behaviors might be the way to go. And if we think of single behaviors, that's where we can actually make some change, and there's evidence that we'll be successful there. If we want to tackle multiple behaviors, if we try doing it all at once, it's going to be quite challenging, and we probably won't be successful. But if we can do one, it often leads to the next one, thinking of that domino effect. All of this is meant to build in the skills so that we're actually very good at managing ourselves. So self-management, which is the session, another session that will be coming up, is really, really important. If we can build up all of these skills, we will then encourage us to be really great at intrinsic motivation. I will do things because I think that I have the ability to do so. I think it is important to do so. I have the confidence to do so. And it's much, much more likely that behaviors will stick if we can actually get there. Number 8, we're getting near the end of this list of identifying opportunities. So change is impossible because I don't have time, right? So in the medical world, when there isn't time to go see people, I can't make that appointment with my regular physician. The medical community has responded by developing these things that are called walk-in clinics, which are important focus of care when we're trying to rush through a day. But I'm wondering if we can take this kind of model and change how we approach things like our health care or change our daily activities. And taking the walk-in clinic to maybe a walk-in clinic. So this image on the left-hand side is one of our therapists, Julia, walking with one of our patients. So this is the way therapy can actually be done. On occasions, I have the opportunity of actually walking with patients as well, and that's how I'll do counseling, which is really tremendous. One of my colleagues at the Michael Garron Hospital took a diabetes clinic, and instead of everybody coming in for the usual sit in a room, come in to see the physician for a 10-minute appointment, what if instead we can turn that around and take everybody out for a walk for an hour? Everybody spends time with the doc, everybody spends time with the nurse, everybody spends time with the dietitian, but everybody gets in a walk. And what we learn from that experience is that we can actually be active, use the same time period, and actually improve health. And what I'm very encouraged to see that there are more walking meetings. A colleague of mine told me at her workplace that now instead of booking room 2A or the auditorium, you can book walking trail number 2, which has a mapped out route so people know where you are at that time, and you'll be a 15 or a 20-minute or 30-minute circuit. That's exciting, and that's actually helpful because we don't have enough meeting rooms in our buildings typically. Identifying opportunities and fun for those of you who ride the subway and see this thing all the time. Not the stairs on the piano, but the escalator versus the stairs. This was a fun experiment in Denmark that was done. I don't know if anybody's seen the piano stairs. If not, go Google piano stairs and have some fun. But typically what we see, if there's a staircase and an escalator that are side by side, 98% of people are going to take the escalator. If all we do is transform the stairs into something that can be fun. In this case, you get a team of engineers to wire each step with a different musical note, so that when you step on the step, it actually makes a sound. And you can actually play a song by jumping up and down the stairs. You can change human behavior so that now 98% of people will take the stairs instead of the escalator because they like to make noise. Isn't that fun? So re-engineering our environments. And think about how technology or measurement and monitoring or social networks can all help us in ways of finding support so we can be successful on our journeys is incredibly important. Finally, number 10. So what happens when our enthusiasm, our motivation, when the novelty wears off? Is this done? Are we done there? And we would pose that actually no. That if we build into our plan that there is going to be a time when behavior will lapse. If we think of the time when you are committed to whatever food program you might be on, and you're going to be on the cruise, you may be able to maintain your keto, your paleo, whatever ism that you're going to follow on the cruise, or you might say, this will be a time where I'll put a pause on things. I know that this will happen at the cruise, at my birthday, at Thanksgiving, at Christmas. These things are going to happen. But the important part is for us to say, not that this is a failure, but actually I am right on the path. I'm exactly where I'm supposed to be. And here's my plan to get started again. And if you've already been used to doing something, you are far more likely, and actually your body is primed to be successful with that on the plan. All right. If you need some resources around any of this stuff, we've gone fairly quickly through all of this stuff. Hopefully if there's something there. If you want to learn some more, here's a few websites that we'll pull out for you. At the Diabetes College site, the Cardiac College site, the Healthy University site, there's all kinds of information about healthy eating, active living, mental health, taking control is all up there. And there's also a platform that we're working on supported by the Medivie Health Foundation around a program called Acceleration, which is really all about this. But how can we help Canadians on their own behavior change journey using all of the principles that we've described? So we're seeing this in action every single day, either for people living with conditions or people who just want to be well. So we thank you for being on that journey with us. So here's the summary of where we've gone through. We want to change, then think about how the world might be primed against us, but despite that, we can still be successful. And if we really want to be successful, let's be thoughtful about this and take a considered approach through this. Think about why you want to do things. Think about where you are in the world right now and how you want to make those changes in a thoughtful way. Think about the barriers that you will overcome. Think about how am I going to set goals and create some action plans for this. And if in the end I relapse, I'm right on plan, ready to keep going. So thank you very much for your time. Thank you for the privilege of spending this time with you. We are now open for questions. And Grace, let's take it away.
So thank you, Dr. O, for your insight and expertise in such an entertaining way. I wish you would be my doctor. So let's go over here, and we're going to start our question and answer period. Are you ready for this, Dr. O?
I am ready. Thank you.
This is good practice for your other 32 seminars this month. Okay, let's start with the first one. In a world where we have access to unlimited information, how can I make sure that what I am reading will help me and not harm me?
Fabulous question. You know, it's another example of where we need to make choices on a daily basis. And around the health interventions, there's some interesting information because if we want to pick up a website, go to a website, pick up an app, download something to our phone, there are thousands of options, aren't there? So I guess what we look for is trust and validation. It's an interesting statistic that my colleague Jessica shares with me that only about 3% of the health apps, for instance, out there have been validated in some way. So if we're meant to do something, improve sugar, change physical activity, improve an eating pattern, you'd love to see that there is some proof that these things actually work in a meaningful and sustainable way. So look for that sort of validation. You know, patients often ask me, should I be taking this supplement, this new medication? And I think it's such a great question. So the thing that we often talk about is, how do I critically appraise something? And one rule of thumb might be, where's the evidence that A is better than B? Is there some study that I can reference in a reputable place where we can actually make some of those decisions? And if in doubt, please ask.
So checking in with the doctor would be very, very important.
Absolutely.
Next question. Why is self-monitoring so important in forming new health habits? What are possible self-monitoring tools that you would recommend?
Outstanding. Well, thank you. The notion of measurement. So, you know, it's said certainly in healthcare and business that we measure what we value, right? And we can't change something unless we're measuring it. The notions that we just talked about of knowing where you're starting and where you want to end up is so critically important. So measurement along the way makes perfect sense. There's evidence, good evidence, that people actually do engage in self-monitoring. For instance, people who have been successful in maintaining more than 10% weight loss over many, many years. The single strongest thing that predicts whether they'll be successful or not, you might guess, is it calories? Is it the amount of protein that they're eating? Is it that they're in ketosis all the time? The main thing is they're actually monitoring what they're eating on a global basis, just keeping track of if it's weight that they're monitoring, and just keeping track of that. So self-monitoring makes all the difference there.
Okay, that's an interesting concept. It seems so simple.
Yeah.
But why is it so hard?
Because we get tired. We get tired of things, right? And we like to look for something new. We also like to look for something quick. It certainly isn't glamorous. If you want to change something, measure it every single day. That doesn't sound good enough. I want something shiny and flashy that will spin and create noises in my ear, and then maybe that'll be the thing. But that'll get pretty tiresome after about a week, and we'll stop doing them. So fundamental, simple behaviors can make a difference. So ordinary things applied in an extraordinary fashion will be the things that will actually help us change.
How do I know if what I am doing is enough? How do I know when to advance my goal?
How do I know when I'm doing enough? And I guess it depends on which goal that we've set out and why we're doing a certain thing. If we apply this in the physical activity realm, for instance, and that's where that might be very apropos, am I doing enough of a workout today or this week? And should I be adding in the latest, greatest thing? Is it time to start spinning, for instance? I guess it depends on where is my goal, so being clear about that and kind of monitoring against that. But I think probably the most important question is, am I still enjoying what I'm doing? If I'm not enjoying what I'm doing, maybe it is time to mix things up a little bit, because we saw the fun factor with the piano steps. If it's not fun, we're probably going to lose this thing. So to mix things up, create some variety, is going to be very important. In our program of cardiac rehabilitation, it's kind of boring, frankly, or it can be very boring. We tell people to walk for 30 minutes or 40 minutes at the same pace, 5 days a week, lift weights twice a week. It's good. It works. It actually changes health in a big way. But I could understand that could be kind of boring. So how do we mix this up? Put in a yoga class. Actually do spin in a thoughtful way, and you can actually do that. Do interval training where things go up and down, where you're actually changing the treadmill or the speed on the bike. It actually becomes much more engaging. Throw in some music. Throw in some people. Let's mix it up.
But they definitely have to check with their doctors before they start any sort of exercise regime.
Yeah, those doctors do play some role sometime. But I would give a shout out. So physicians are a good resource, but there are many wonderful allied health team members that we can rely on. Certainly we see that in rehabilitation in spades. The physiotherapists, the exercise therapists, the OTs, the speech therapists, the psychologists, the social workers, the dietitians. I'm going to miss some people and offend some people, so I apologize. The nurses and sometimes the docs can play a role in this, but there are many people we can rely on to provide really good advice. Next question.
Why is it discouraged to set weight-based goals?
Yeah, so weight is an interesting thing. When people come to our program, about 30 or 40% of people, if you just go cold and say, what is your goal? They'll say, I want to lose weight. And that may be a common thing, especially as January 1 is rolling around. We got to think about New Year's resolutions. Weight is often the thing that people put up. So why might we discourage it? It's not that weight is a terrible thing. There is association between weight and some adverse health outcomes. Some medical societies have said that obesity is another chronic condition. We have a counter view to that, though, that the reason we don't emphasize weight so much is that weight may or may not be modifiable. The important thing is the health behavior, and thinking of the why as well. So why are we losing weight? So
just a question. Why do you say not modifiable? Some weight might not be that.
Yeah. So an example might be that even clients in our own program, they will say, weight is my goal. I'd like to lose 10 pounds over the next 3 months. We'll say, okay. So what will you do along the way? So I will get more active. I'll build in those walks. I'll even do interval training. I'll do my weight training. I'll put more plants and vegetables and fruit and nuts and seeds and fiber into my diet. I'll change my protein intake to more plant-based, and I will have less red meat. We'll say, outstanding. At the end of the 3 months, weight may or may not change, actually. We may convert some fat into muscle. Great thing. Metabolically much, much better. We may not achieve a 10-pound weight loss. And the way we frame weight, though, if weight was the only thing that this is about, our clients will say, I have failed in my endeavor. On the other hand, if you are now working out 5 days a week and lifting weights and eating more plants and nuts and seeds and fruits and vegetables and fiber, having more water, less red meat, more plant-based proteins, this is a big, big success, right? And what are the things that predict whether we're going to live or die over the long term? It's not the number on the scale. It's all of those other things, whether I move on a daily basis, whether I eat plants and vegetables, so et cetera. So we focus.
That consistency in those.
It's the consistency, but it's also the behavior. Because we can change our behavior, we may not change a number. And the behavior is the really important thing here.
I think we have a question from the audience, Dr. O.
Hi, Dr. O.
Hi.
Just wanted to ask you about the possibility of integrating health coaching into some of the chronic and complex patient interactions. How do you see that? What's the future of that? And what do you think we're going in healthcare with health coaching?
Yeah, outstanding. So the question is about health coaching. And a lot of what we've described today is not, and the medical model of the future is not about, here's a prescription, take these drugs, right? Or here, go for this test. It's more about how we work together with teams, with our clients. So I agree completely that the ideas that we've talked around change and behavior and motivation is about health coaching. We see examples of where this is being well integrated. Our world, in particular around rehabilitation, is a great model where health coaches are actually part of the journey. Whether we label them as such, whether you're working with a nurse or an exercise therapist or physiotherapist or social worker, that often the role of the professional is to provide that kind of case-based coaching, problem-solving, guidance with action planning. So we actually do it in bigger ways. And I think with the move towards prevention upstream, care outside of hospital walls to some degree, that this is where it really needs to go to really change how we can influence chronic disease management.
Thank you. Just one more question, just to go back to your slide at the very beginning with the tree and focusing on the root of the problem. So in chronic disease, you look at the readmission rates at hospitals, being, a particular hospital, 140,000 patients a year, 5% of the population is using 84% of the healthcare spend. Where do you see us going overall as a healthcare system with those numbers growing?
So it's a really important point. So chronic disease is where we're spending all of our time. We have been very reactionary in some ways, that we wait for bad things to happen and then we bring people to hospitals and we look after them. And we do that extremely well. And there's been incredible advances in care, whether it's surgical intervention, devices, medications, overall systems. So don't want to downplay that. But as you're suggesting, that there's going to be more and more of this. So the emphasis on primary care, loci of care in the communities is incredibly important. More attention to prevention. As you are aware that we spend less than 1% of our healthcare budgets on prevention right now. But if we get to the root of the tree, the root of the issues, that probably deserves a whole lot more attention than we are currently providing at this point. And that's how we'll bend the curve on health going forward.
Thank you very much.
Great, thanks.
People were paying attention during your presentation. Next question. I find it hard to stay motivated to go to the gym. That's not me, Dr. O.
No.
Do you have any recommendations as to how I can improve my drive to go?
How do we stay motivated? So this is a very personal question, right? So part of the conversation might be going through some of the tips and tricks that we've talked about today. So thinking about what is the why for this, what's going on right now, and maybe redefining what our purpose and our goals might be. Could it be that we need to change the fun factor in what's going on? Could it be we need to change our social network? Get some new friends, would you? Friends that actually care about you. Give up those other people, would you? Or could it be that we need to address some other barriers, whether it's time or inconvenience? So maybe there's a different kind of thing. And we certainly see those trends happening in our environments now, of where there's more exercise coming to home. I won't name any particular brands, but we're seeing this right now, right? Where you can create that experience in your own basement of that live session, which I think is very interesting. Whether that will be sustainable for some people, it might be, because we're connecting differently. Some people still might like to sweat with somebody else, and that'd be exciting. So finding what really works for you and kind of taking advantage of the broader menu of opportunities, I think makes a difference.
I can appreciate that. What works for you, I found a regime that I enjoyed 4 years ago, and it's fun still, and that's what motivates me. Do you have a regime? Is there something you particularly like to do?
So the activity that I've been into for the last few years, I don't know if it's fun, but it's something that I do. So at the age of 50, and I tell this story in other kinds of sessions, so the decision at 50 was to take up middle distance running, which was a very new thing because I'd never done that before. Finding ways to keep that interesting has been a perpetual journey, shall we say. So, 5 years later, 13 half marathons later, I think there's 8 pairs of running shoes later that we're still doing this. How do we keep motivated around this? Number one, the why for me is this makes me authentic. So it allows me to have this conversation with you or with a group of patients to say, this is good for you, and I do it too. I will commit to the 3 or 4 days of working out, just like you. And even better, that we can do this together. So next Thursday evening, we'll have a group of our graduates coming to the program, and we'll do 5K together. And in the first weekend of December, so I'm doing this public declaration, that we will run the Tannenbaum 10K together. And that's what makes it exciting and motivating.
So you obviously follow your own advice.
Yes, but sometimes I resist.
You're human then. Next question. It's hard to stick to healthy diet plan to a healthy diet plan when you are the only one within your household who is taking it seriously. Do you have any advice as to how to keep the entire family on track?
Yes. How do you motivate an entire family? So I guess it depends on what position of power do you have in this family. If you are the sole person cooking, then it becomes very easy. My 23-year-old was introduced to tofu the other day due to peer pressure and because I buy the groceries. He said, this is a lot of nothing. So that was not fun. So, but we had it a second time even. Having those open discussions about why this might be important as opposed to imposing change, yeah. So tofu may not be the most fun thing, but if the why is that it's really actually very important to me to follow this dietary pattern because my health is important to me, or my health is at risk. I need to lower my blood pressure, I need to lower my cholesterol, I need to control my sugar, and the most powerful way that I can do this is making smart food choices. I need you to be part of this journey with me. Will you be part of my team? Like to have that kind of frank discussion might be a tough one, but I think actually very worthwhile because it is so critically important.
How about you mentioned tofu. Do you have any superfoods that you enjoy? Is there anything that you have discovered really makes a difference in your life? I'm asking for personal advice here.
So cool. This is peeling back more layers. So those of the folks that work with me know that my go-to meal in the middle of the day is Greek yogurt and blueberries with granola, but that's only and almonds because that's the only lunch that I can make actually on the go. So it's highly complex cooking, but it has the right kind of features in it for me. That if I'm getting a healthy source of protein with some fruit, vegetable, plant-based something with some nuts and seeds all in one. That's a good go-to for me. So for all of us, it's going to be very personal of how do I develop those balance points. Others are very good at carrying tubs of salad with them, which is great. For me, who might be living out of my car for hours or days on end, it may not be the friendliest kind of lunch for me. But find the thing that works for you. But it does take some prep. And the trap that we don't want to fall into is I got to go run out to the fast food place to grab my lunch or my dinner because I haven't planned this far enough in advance. Like it just needs a little bit of effort on the shopping front, and they'll be ready to make those tough decisions. But we can make the right ones.
Interesting choice, yogurt and berries and nuts. You've been saying that throughout your presentation.
Yes.
So, last question. What do you think about nudges for behavior change? Are there proven nudges that work?
Yes. So nudges, if we think about kind of choice architecture, behavioral nudges, so incentives. So incentives can work. Like who in the room has some kind of points program that you follow? Shoppers, Cineplex, like everybody does something. Is that strong enough because you will engage with that that store for a year to earn $10, frankly. But you'll do it because we like nudges. Nudges are in society, and it forces us to do certain kinds of things, whether it's overt or covert. In healthcare, there's a little bit of evidence that nudging, incentivizing, may make the difference a little bit in health behavior. It's not that strong, and it's not for everybody. It may be too extrinsic versus intrinsic in nature. So used selectively, I think we can harness their power for good.
Okay, Dr. O, so that concludes our question and answer. Good answers, by the way. You passed the test.
Thank you very much, Grace.
So today's webinar will be posted on YouTube next week so that you will have the opportunity to view it again or share it with your family, friends, and colleagues. You can find the link on Toronto Rehab Foundation site, www.torontorehabfoundation.com. As I mentioned, today's session is the first of a 4-part series, the second of the series beginning again in January. During Mental Health Month on January 28th, we will discuss mood disorders, depression, strategies to cope, such as mindful meditation. Doctor, would you mind being my assistant? Our spring webinar will dive into the basics of nutrition and healthy eating, looking at Canada's new food guide and eating choices such as ketogenic and vegan diets. Our final June webinar will focus on the basics of exercise, exploring some common myths and misconceptions. Following today's broadcast, we will be distributing an online survey and would appreciate your feedback. You can talk about Dr. O's outfit, maybe. I also encourage all of you to follow Toronto Rehab Foundation. So I guess on the monitor, we should have some Twitter, Facebook, and Instagram addresses. And then the conclusion, so Dr. O, that concludes today's webinar. Thanks for being my assistant. Thank you for your insightful and creative way of talking about serious issues. Thank you for joining us, all of you, on this journey to change for good. A journey to change for good. That's what's written here. We all hope you join us again in January. And thank you, Toronto Rehab staff, for putting this together and for attending today. Thank you all. Have a good day.
Thank you, Grace.